Hello everybody and welcome to the Thursday edition of Video Clips. And for those of you who know me, you're not going to be surprised at this statement. I love yoga. And I love yoga so much that Wellness Farm Health actually acquired a hot yoga studio and moved it into our facility several years ago. I love the fact that it's right across the hallway from my office because I can go to yoga all the time. And it's benefited me a lot. I've enjoyed it. Yoga's helped me to recover from a serious injury. I've gotten stronger. I have balance and coordination. It's improved my ability to focus and concentrate. And I have to tell you, sometimes keep my sanity. And many studies have shown that all those things are pretty typical benefits that people get, and that yoga measurably improves health for people who practice it regularly. So, a new review included 32 randomized controlled trials with close to 3,000 participants to determine the benefits, and the length of the trials ran for a long time, or a wide range of times, ranging from 3 weeks to a year. And the control groups included subjects who got routine care, no intervention at all, cognitive therapy, aerobic exercise, wide diversity of other activities in addition to yoga that were used as controls. A comparison of yogis with sedentary people showed that individuals who practiced yoga were able to lower their LDL cholesterol, their total cholesterol, blood pressure, body mass index, triglycerides, and heart rate. When yoga was compared with aerobic exercise, it was comparable in improving body mass index, weight, blood pressure, cholesterol, and triglycerides. And the researchers concluded that yoga might be as beneficial as cycling and fast walking for improving cardiovascular risk factors, and also noted that it could be a very good alternative for elderly people, people with lower physical tolerance, and people who have musculoskeletal issues and joint pain. And by the way, yoga is a great starting exercise along that line for people who are in pain and can't do a lot more aggressive exercise. Now, the good news is yoga is definitely attracting more people. In addition to being offered at almost every athletic club and recreation center, it's even available to high school students as part of their phys ed program, which I think is great. When we purchased our studio, just to give you an idea of the growth, we were the only hot yoga studio in town. Now there are like 24 or 25. All of them are doing well, and I think that's a good sign. I don't mind the competition. I like the fact that a lot of people are going. And this is neat. The United Nations has proclaimed June 21st the International Day of Yoga. So I guess I'll plan to be in yoga class on that day. If you haven't yet tried yoga, do it. And if you don't like the first class you take, try different studios and classes and teachers. There's so many different styles of yoga. I'm pretty confident that you can find one that you like. And I think that you'll enjoy it as much as I do if you stick with it a little bit. One other benefit I'll mention is that, and there's actually a study that confirms this, that people who go to yoga are nicer. I know I'm always a nicer person after yoga class, and if you like, you can confirm that with the Wellness Farm staff. They will be happy to let you know that that's the case. All right, so go to yoga. That's the bottom line. All right, now on to a little darker topic here. Did you know that binge eating is a real medical condition? It's called binge eating disorder. It was recognized as a disease by the American Psychiatric Association in 2013. And now binge eating even has a spokesperson, Monica Seles, the retired tennis player, and of course there's a drug to treat it. Shire Pharmaceuticals won approval just a few weeks ago for Vyvanse as a treatment for binge eaters without even a hearing on the subject. I'll come back to that later. In the meantime, Monica has been making the talk show rounds to bring awareness to the issue, because so many binge eaters don't know that they're binge eaters and that they're sick and they need drugs, apparently. She claims that during her career as a tennis professional, she suffered with this, and now she wants to help other people by letting them know. I guess she feels the best way to do that is to get paid to promote drugs. Well, Shire has a real colorful history. The company played a major role in medicalizing attention deficit hyperactivity disorder and has made billions of dollars marketing drugs to treat it, Vyvanse being one of those drugs. The company has also paid fines for using illegal marketing techniques to sell ADHD and other drugs and for marketing Vyvanse. Now, this is an amphetamine. And there are a lot of reasons for concern about the drug, because amphetamines are often abused when used to treat obesity. They're addictive, and cognitive therapy has been shown to be much more effective for people who have these conditions, much better without the side effects, obviously. An article about this issue appeared in the New York Times and quotes an FDA spokesperson as saying that the reason why Vyvanse was given priority approval was because there were no other drugs available to treat binge eating disorder. Well, my gosh, we got to have a drug to treat everything, right? She added that an advisory committee meeting wasn't necessary to review the issues since Vyvanse has been on the market for a long time and its safety has been established. And that's such a, I don't even want to go there. All right, so the Times article described how Shire is capitalizing on this whole thing by using strategies proven to work in the pharmaceutical business. Now, an important part of the strategy is to take a celebrity like Ms. Sellis and to get patient advocacy groups in promoting use of the drug. Shire has made a lot of donations to these patient advocacy groups, after which the groups started using social media to direct people to a Shire website that counsels patients on how to bring up binge eating disorder with their doctors, and it encourages patients to not give up, even if the doctors resist the notion that they have a disease and need drugs. The website doesn't mention the drug, but instead it gives the appearance that the information is offered as a public service. This is a common strategy. Increase awareness of a new disease, convince lots of people that they have it, and then train them to visit doctors and ask for the drugs and demand treatment. The Binge Eating Disorder Association got $100,000 from Shire in 2014, and its founder, Shaviz Turner, says that doctors haven't been educated and they don't know what to look for. Apparently we want doctors looking for this disease. Shire's committed considerable resources not only to online advertising but physician education programs to raise awareness. Vyvanse is already a big seller. It generated $1.4 billion in sales for Shire during 2014, and Shire's CEO is quoted as saying that he predicts binge eating will increase sales by another $200 to $300 billion annually. In view of these types of numbers, I want you to consider this. Shire's fine for all their illegal activity in 2011 was $56.5 million. That's just a cost of doing business. That was for this drug, by the way, penalties for misbehavior in marketing the drugs. Shire denies that it did anything wrong, but the allegations were that the side effects of Vyvanse included addiction, and the claims made about the drug, listen to this, they actually claimed that this drug's benefits included preventing car accidents, preventing divorce, preventing arrest, and preventing unemployment. How these people do this with a straight face is beyond me, and how the American public continues to trust people who put forth this type of drug is amazing to me too. The clinical definition of binge eating disorder is at least one episode of uncontrolled eating per week for at least 3 months with a feeling of shame following the episode, and it's estimated that 2.8 million Americans are affected. That'll produce a land office business for the drug companies. There are several concerns, starting with the troubled history of both Shire and the misuse of amphetamines, which until recently, in fact until right now, were tightly controlled by the FDA due to a record of abuse. The FDA has instructed Shire not to market Vyvanse as a drug to treat obesity. Well, I bet that'll do a lot of good. But overeaters are often obese. Go figure, right? Shire estimates that 80% are. This means that the drug will most certainly be used by people who have, by groups of people who have already been proven to be harmed by it. There just seems to be no end to the made-up diseases that the American psychiatric profession is willing to recognize, and the drug companies are always willing to educate the public and the medical profession about their solutions. All right, so that's all for now. Have a great day. Tell people to just say no to this ridiculousness, and if you're an overeater, find constructive ways to deal with it. Go to your local cognitive therapist and address the source of the issue. Don't take drugs. I'll be back to you again next Tuesday with more news, and as usual, pass this on to anybody who you think would enjoy watching it.